the topic of discussion that we are going to deal right now is we are going to talk about what potassium sparing diuretics. So under this topic what we'll do is our workflow will be, at last we'll be revising through the content of first aid. Before that we'll be going through all these contents. Now without any delay, let's move directly into the topic. Right now, here I would like to add one image, and this is this image. So here what you'll see is, what is this? This is this region of our collecting duct, right? This is this region of our collecting duct, and this is the place where our this potassium sparing diuretics are they act, right? This is the place where potassium sparing diuretic act. So here in this region, what we'll do is we'll just magnify this region, and when we magnify this region we'll find this thing. So what is this? This is our lumen, right? What is this? This is our lumen. As you can see, this is the lumen of collecting duct, and in this side what we have got is that we have got cell within this collecting duct, right? Here this is collecting duct cell. This is the cell of collecting duct. Okay, what is this? This is our lumen, right? This is our lumen, as you can see, and this is the cell within our collecting duct, right? Okay, now here what will happen is that here we have got three transporter. One is sodium, another is potassium, another is hydrogen ion transporter. So here the thing is, here this sodium ion transporter, it helps in reabsorption of sodium. This potassium, it helps in excretion of potassium, and hydrogen ion is also excreted here. So this is what here we have got three transporter, right? Now the one important feature of these three these three transporter is that when we just inhibit the sodium reabsorption, at that time these both phenomenon will be stopped. That means sodium reabsorption regulates this excretion of potassium and hydrogen ion. So whenever we inhibit this thing, what will happen? There will be inhibition of these two transmitter also. Now another thing that we need to know here is, right, in this cell, right, in cell within this collecting duct, there is one receptor, and this is our aldosterone receptor. What is this? This is aldosterone receptor. When this aldosterone binds in this receptor, right, in this aldosterone receptor, then only there will be the activation of all these three transporter. That means there will be reabsorption of sodium, excretion of potassium, and excretion of hydrogen ion. So what we can do here is, now here in this case what we can do here is, in order to block these function, right, in order to block these function, what we can do is, one thing that we can do is we can inhibit the sodium reabsorption, or another thing that we can do is we can do the inhibition in receptor of this aldosterone, right? Okay, that means we can do it through two process, right? Now what are the two process? They are, one is aldosterone receptor antagonist, as you can see right here. Another is our epithelial, right? Epithelial, it is present in our epithelial sodium channel antagonist. Okay, that means, okay, till now what we got that these potassium sparing diuretics, they act on what? They act on collecting duct, right? They act on collecting duct. Now there are two process how we can do it, right? How we can do it. The one is through the inhibition of epithelial sodium channel antagonist, through what? Aldosterone receptor antagonist, right? Now as you can see, now okay, let's move toward the things, right? Now one is our aldosterone receptor antagonist. Yes, we have talked about it. One is epithelial sodium channel antagonist, right? Now the drug that will act through aldosterone receptor antagonist are our spironolactone and eplerenone, right? Now how we are going to memorize it? We are going to memorize it. Now here you can see aldosterone, right? There is ONE at the end. What is there? There is ONE, right? Aldosterone. And there is in spironolactone also we have got ONE. In eplerenone also we have got ONE. So what are these? Spironolactone and eplerenone, these are what? These are acting through which process? These are acting by inhibiting this region, right? This region. Now another thing is that epithelial sodium channel antagonist. Now these are amyloid, amyloid, and another triamterine, right? Triamterine. So these are the four drugs that we need to memorize. Now how we can memorize these four drugs? We can also memorize as what? We can also memorize at what we are studying. We are studying potassium sparing diuretics, right? Potassium sparing diuretics. Now these PAS TE. From A, what we have got? We have got amyloid. From A, we have got amyloid right here, right? From S, we have got spironolactone, right? Spironolactone. We have got spironolactone, and we have got from T, we have got what? Triamterene. From E, we got eplerenone, right? Now we can memorize it as with the help of this acronym also. Now what this drug cause, right? When we just administer this drug, what they will cause is, they will cause what? When we just, okay, here you can see, now when we block these things, what will happen? There will be what? There will be impairment in reabsorption of sodium, because of which there will be what? There will be excessive loss of sodium, right, in urine, and this excessive loss of sodium will parallelly take excessive amount of water in urine, and that will cause what? Diuresis, right? Diuresis. Similarly, now here there will not be excretion of what? Our potassium. So what will happen? The potassium level will be increased, right? The what will happen is that there will be what? There will be no excretion of what? Potassium. So the potassium level will be increased in blood, and that will result in hyperkalemia. Now similarly, there will be no excretion of sodium, no excretion of what? Our hydrogen ion. So it will cause what? It will cause increase in hydrogen ion concentration in blood, and that will cause acidosis. So what are the things that will happen? One is our diuresis will happen, right? Diuresis. Another is hyperkalemia, and another is what? Our acidosis will happen. So because of these drug, what will happen? There will be decrease in reabsorption of sodium and hydrogen, and as there will be decrease in reabsorption, there will be what? There will be excessive excretion of sodium and water, and that will cause diuresis. There will be increase in potassium level in our circulation in our blood, that will cause hyperkalemia. There will be increase in hydrogen ion, that will cause metabolic acidosis. Now, yes, I have mentioned how we are going to memorize these things. We are going to memorize these things with the help of what? PAST acronym. From potassium sparing diuretics, we have got amyloid, we have got spironolactone, we have got triamterene, we have got eplerenone. And now, since this spironolactone and eplerenone, these falls under the same thing. What this falls under? This falls under our aldosterone and receptor antagonist, right? Now the difference is that this our spironolactone, it causes gynecomastia, whereas our eplerenone, it does not cause gynecomastia. So that is the difference that we need to know, right? Now another important thing that I would like to mention right here is, now our this potassium sparing. Now why it is potassium sparing diuretics? Because it is what? It is not causing what? It is not causing hypokalemia. That means the level of the level of potassium is increasing in our bloodstream. It is not causing excretion of potassium, so it is called potassium sparing, right? That is the reason. Potassium will not be excreted, so what? Okay, as you can see, the potassium will not be excreted, so what? It is called potassium sparing diuretics, right? Now moving further, one thing, important thing that I like to mention here is, now all the diuretics, right? All the diuretics, loop diuretics, our thiazides, carbonic anhydrase, our mannitol, what they do is, all the diuretics work from luminal side, right? From this side, these work, right? These work from luminal side, except what? Our aldosterone antagonist. Now where are these aldosterone antagonists working from? These are working from basolateral side. As you can see, these are working through this side, not from our luminal side, right? Now here also epithelial sodium this epithelial sodium transporter antagonist, it is also working from what? Our luminal side, but our this aldosterone receptor antagonist is working from basolateral side, and it is only the example of diuretics that works from basolateral side. Now talking about its uses, what are its uses? Talking about its uses, it is used in what? Conn's syndrome. Now what happens in the case of Conn's syndrome is that here there will be maximum amount of aldosterone secretion, right? There will be maximum amount of aldosterone secretion. So now if we block the receptor of aldosterone, then obviously the effect of aldosterone will be minimized. So we use what? Our aldosterone antagonist in the case of Conn's syndrome, so that the excessive amount of aldosterone that is produced during this condition will not what? Will not act, or will not manifest its work. Now it is also used in the case of edema in cirrhosis. Now what will happen in the case of in cirrhosis is there will be what? There will be compensatory increase in aldosterone level, right? Now in the case of cirrhosis, right, edema in cirrhosis, aldosterone level will be increased. Now the same story. Now in order to prevent its action, what we can do is we can just provide aldosterone antagonist, right, so that the excessive amount of aldosterone which is produced could not come into action. Now similarly, what is done, now it is also used, right, in the along with other diuretics that causes hypokalemia, because here there is what there is here what is going on is that there is prevention of excretion of potassium. So it prevents hypokalemia caused by other diuretics. So it is used along with other diuretics to correct the potassium level. Similarly, it is also used in the case of what our CHF, right. Okay, now congestive heart failure. Now here what will happen is that this congestive heart failure is caused because of aldosterone. Because why? Because the we know that left ventricular hypertrophy, that is our cardiac remodeling, it is caused by aldosterone. So if we just block the action of aldosterone, then obviously this thing will be prevented. Now similarly, it is also used in resistance hypertension, and here the drug of choice is what our aldosterone antagonist, because our this aldosterone what it does, it cause retention of sodium and water. Since it causes retention of sodium and water, what will happen is that there will be increase in what blood pressure, and here it can be what, that is what we are talking about, hypertension, right, resistance hypertension. So to prevent this thing, what we can do is we can prevent the action of aldosterone through aldosterone antagonist. So this was about what, this was about our potassium sparing diuretics. Now let us move toward the content of our first aid. Now talking about the content of first aid, yes, here initially it is mentioned about the mnemonics, right, acronym for memorizing the drugs. It is written the keep your seat, and we have mentioned that we are going to memorize it through what, we are going to memorize it through our what, PASTE, same thing. Okay, now mechanism, talking about mechanism, spironolactone and okay, one is our spironolactone and epinephrine, right. These are competitive aldosterone receptor antagonist in cortical collecting tubules. Yes, in cortical collecting tubules, we are not talking about the medullary collecting tubules, we are talking about cortical what collecting tubules. And okay, yes, we just study about these things. Similarly, our triamterene and amyloid blocks sodium channel at same part of tubules, yes, at epithelium, which are present at epithelium. Now its clinical use are hyperaldosteronism, aldosteronism, right. Yes, we studied hyperaldosteronism in what, Conn syndrome, right. Similarly in edema cirrhosis. What is another condition? Okay, another condition was our what, in the case of, okay, these were the two things that we studied. Okay, it is also used when there is potassium depletion. In heart failure, hepatic ascites, that is spironolactone is used. Nephrogenic, right, diabetes insipidus, that is amyloid is used. Anti-androgen, in the case of anti-androgen, that is spironolactone is used because it causes what, gynecomastia. Now its adverse effects are obviously hyperkalemia, can lead to arrhythmias because of this excessive hyperkalemias. Endocrine effect with spironolactone can be seen as gynecomastia, right, anti-androgen effects, that is anti-androgen effect. So this was all about our potassium sparing diuretics. Hope you are clear with the concepts.